Healthcare in America is at an all-time low this year. As time passes, the amount of Americans faced with high costs, limited access to care, and inequalities within our system increases every day. According to Brookings, America spends over $4.5 trillion annually on healthcare, and despite this, we are ranked last compared to 11 other countries. According to the Kaiser Family Foundation, the average American family now spends over $20,000 annually on health insurance premiums and out-of-pocket costs. These costs have grown 50% in the last decade, outpacing inflation. As a result, many Americans are forced to delay or forego necessary care, sometimes leading to more severe and expensive health issues down the line. Healthcare costs are higher than ever. According to CMS, in 2023, U.S. healthcare spending exceeded $4.3 trillion, making up 18% of the nation's GDP. Despite this astronomical spending amount, millions of people face barriers to essential care. This means that nearly $1 in every $5 in the U.S. economy is spent on healthcare. But despite this massive expenditure, millions of Americans still face significant barriers to essential care. Why is that? The answer lies in inefficiencies, inequalities, and structural issues within the healthcare system itself. First, much of the spending in the U.S. healthcare system does not directly improve patient care. A significant portion of the budget is used up by administrative costs, complex insurance systems, and profit-driven healthcare providers. According to Commonwealth Fund, studies show that administrative costs in the U.S. account for more than $200 billion a year, far higher than in other developed countries. In fact, administrative costs make up 25% of healthcare spending, a percentage that's far above countries like Canada, where healthcare is less fragmented. Despite the large amounts of spending, there is a lack of universal coverage, as unlike other countries, the U.S. still heavily relies on private insurance, with the patchwork of Medicaid, Medicare, and employer-sponsored plans. This system leads to inequalities in access to care. 23 million working-age adults in the U.S. were still uninsured as of 2022, according to Brookings. Americans remain uninsured and many more underinsured, meaning that they have health insurance but still struggle to afford out-of-pocket costs for necessary treatments, medications, and procedures. High deductibles, copays, and premiums make it prohibitively expensive for many to access the care they need. Third, the U.S. healthcare system encourages quantity over quality care. The fee-for-service model rewards doctors and hospitals for performing more procedures, tests, and treatments rather than focusing on outcomes and preventative care. This results in a healthcare system that is more interested in increasing the amount of services provided rather than ensuring the best possible health outcomes for patients. According to the Washington Post, despite the U.S. spending more per capita on healthcare than any other country, we rank last among 11 high-income countries in outcomes like life expectancy and infant mortality, which are indicators of a country's overall health system effectiveness. Moreover, prescription drug prices in the U.S. are the highest in the world. A combination of the lack of transparency in pricing, limited government regulation, and the profit-driven pharmaceutical industry has led to medication costs that are unaffordable for many Americans. According to the Peterson Foundation, Americans spend nearly 50% more on prescription drugs than citizens of other high-income countries. The ADA states that essential drugs like insulin have seen price spikes over 1,000% in the past 2 decades, causing serious health and financial consequences for millions of diabetic patients. Lastly, while we have world-class healthcare facilities and some of the most advanced medical technology, access to this high-quality care is often limited to those who have the means to pay for it. Rural areas, low-income communities, and minority populations continue to face disparities in both access and quality of care. The healthcare workforce, especially in underserved areas, is under-resourced and overwhelmed, exacerbating these inequities. So, while we spend more on healthcare than any other nation, these systematic inefficiencies and disparities prevent Americans from receiving the care they need when they need it.
There are several misconceptions about solutions that are already in place. Myth: Medicaid expansion is solving the problem. The fact is that according to Kaiser Family Foundation, there was a Medicaid expansion that reached 41 states as of November 2024 and has provided coverage for millions of Americans. However, this still leaves countless individuals that fall into a coverage gap, which is a temporary cap on what someone's health insurance plan will cover for a period of time. Those who fall into this gap earn too much to qualify for Medicaid, but not enough to afford private insurances. This causes several struggles with Americans, especially in states where the expansion has not taken place. Myth: Health saving accounts, also known as HSAs, are the answer to affordability. While the fact is that according to the Consumer Financial Protection Bureau, HSAs are used to support the solution of high health care costs, but the reality is that it only applies for those with a high income. Less than 50% of Americans that can utilize HSA, and 40% of Americans don't earn enough to cover the cost of simple routine checkups. This leaves low-income families at a large disadvantage when it comes to health care.
Expanding access to medical care will create a significant difference to all Americans. Expanding Medicare with the Affordable Care Act will give more Americans effortless access to health care, which will give everyone a chance at good health. MedPAC 2023 states only 71% of physicians accept new Medicare patients. Even KFF 2022 states 36% of Medicare beneficiaries report difficulty finding a doctor who accepts their insurance. The Commonwealth Fund discovered around 48% of working adults that have faced issues in the past year due to the cost. High costs are a pressing issue within the healthcare, and it is the main reason why several families avoid getting the attention they need. By regulating costs through drug pricing regulations and promoting value-based care by capping medication costs, healthcare can shift its focus on quality rather than the quantity of the services. By controlling drug prices and promoting value-based care, we expect significantly lower overall health costs for both the patient and the system as a whole. According to MedCity News, expanding Medicare drug price negotiation could save the system over $450 billion within a decade. We aim to focus on the healthcare's well-being. All the while they are facing levels of burnout, overwhelmed by long hours, and the emotional toll of providing care. To address this, we will invest in comprehensive mental health support for healthcare professionals, ensuring that they have access to counseling, support groups, and resources to maintain their well-being. Additionally, we will focus on implementing reasonable workloads. We also want to ensure healthcare professionals have the support they need to do their jobs without overburdening them. A healthy and well-supported workforce leads to better patient outcomes, more satisfied providers, and a stronger healthcare system overall.
Despite good intentions, current solutions like Medicaid expansion, HSAs, and medical school expansions are not enough. Here's why. Medicaid expansion. According to the National Institutes of Health, Medicaid expansion reduced the number of uninsured by 17% in participating states. It still leaves millions without coverage. The Kaiser Family Foundation reveals, in states that haven't expanded Medicaid, 2.2 million people remain in the coverage gap. This is a significant issue that requires a national solution, not state-by-state efforts. HSAs, health savings accounts, are designed to help individuals save for medical expenses, but their benefits are often more accessible to higher-income individuals who can afford to contribute regularly. According to the Kaiser Family Foundation, data indicates that HSA participants tend to have higher incomes. For example, in 2004, the median adjusted gross income of tax filers reporting for HSA contributions was about $76,000 compared to $30,000 for all tax filers under the age of 65. Medical school expansion. The push for more medical school slots has not solved the shortage of healthcare providers. The American Association of Medical Colleges states, despite increasing the number of medical students, the U.S. is still projected to face a shortage of 124,000 physicians by 2034. Expansion alone won't meet the demand for primary care professionals. Training, incentives, and better workforce distribution are needed. Now that we understand that current solutions have several faults, we have developed a healthcare reform bill that tackles these issues. Expanded access. Expanding access to healthcare in specific areas, such as undeserved urban areas, will increase the amount of Americans able to receive medical care annually. With medical places in remote areas, the gap of individuals not getting the help they need begins to close, ensuring that families stay healthy. Systematic reform. We will streamline the healthcare system, cutting administrative waste that costs over $200 billion every year, according to Brookings. This reform will help reduce premiums, copays, and out-of-pocket expenses by making the system more efficient. By doing this, American families can save up to $2,500 annually on healthcare. Strengthened workforce. The shortage of healthcare professionals is critical, especially in rural areas. According to HRSA, 60% of counties face a shortage of primary care physicians. To strengthen the workforce, programs such as funding training programs, loan forgiveness for those working in undeserved areas, and creating new career pathways for non-traditional healthcare workers.
Even with these solutions, some questions remain unanswered. How do we address the everlasting increasing cost of pharmaceuticals, which have drastically risen in the last decade? How can we ensure equitable access to care, particularly for marginalized communities and rural areas? How can we close the wealth gap, ensuring that healthcare is affordable for all, regardless of income?
By utilizing this data and our solutions, we are able to create a healthcare system that benefits everyone. Healthcare is a right and not a privilege.